I had some questions about releasing the psoas muscle recently, and I'd like to address it here. Yes, I have released many psoas muscles before, but it's not my go-to. It's not a feel-good muscle to work on, and it's often not the culprit anyway. There are like 5 other hip flexors that are more likely to be the problem than the psoas muscle. The psoas is your strongest hip flexor. Not to say that it never needs to be worked on, but here, I'll show you a quick hip flexor stretch and then some variations to tell which hip flexor it is that is actually giving you the trouble. I'm into a kneeling lunge position. My heel is under my knee. My other knee is under my hip. My toes are pointed back. From this position, tuck your tail. So we're doing like a posterior pelvic tilt. And where do you feel that? If you feel it up here in your abdomen, then you probably have a tight psoas muscle. If you're not feeling anything here, you probably don't have tight hip flexors at all. But there's a couple more positions to try. So you have your superficial quadricep muscle, rectus femoris, runs down the front of your quads, but it also flexes the knee. So if you bring that back leg up onto the toes, flexing the knee a little bit more, and then posterior tilt, you should feel a stretch straight down the center of your quad muscle. That's your rectus femoris. Put my toes pointed back so that we're not exacerbating the rectus femoris, and I'm going to move my foot behind the other heel. So I've externally rotated my hip. My knee is now pointing out in this direction. And same thing. I'm going to do that hip thrust, posterior tilt. Now, these are the muscles that are most common to be your hip flexor issue. Glute minimus and tensor fasciae latae. So right here on the side of the hip is where you'll feel that, if those are the culprit. The other muscles that are often tight for hip flexors are your anterior adductors. So the front inner portion of your thigh, coming from your quadriceps medially into the groin. And then same kind of thing for those anterior adductors. They're also internal rotators. So we're going to externally rotate the hip, but I'm going to move my legs a little further apart. So I'm opening up the hips. And then same thing. We're going to externally rotate, so my knee is pointed out this way. And then hip thrust, posterior tilt on the pelvis. And you'll feel that right away. Those are a few hip flexor stretches to try before you go digging into that psoas muscle that probably doesn't need it.